The health insurance bill may be new to South Africa, but some countries such as Thailand and Ecuador have actually introduced universal health coverage reforms since the early 2000s. The NHI Bill passed earlier this month and has been widely criticized for various reasons. In fact, some of them saying that it's flawed in its policies. So let's take a look at the bill from perhaps a global perspective and also get you a sense of what South Africa can do in learning from these other countries. The Executive Director of the Center for Universal Health at Chatham House is Robert Yates, who's currently in the country actually advising several stakeholders around the NHI Bill in South Africa. He joins us now live from a load-shed Cape Town, I understand, Robert. It's lovely to have you on the program. Thanks so much indeed for making time. Perhaps let's begin with context around where we actually fit into the greater sort of trends globally. It was several years ago when a number of countries, including South Africa, by the way, reaffirmed their commitment to universal health coverage at the UN General Assembly. I wonder how much work has been done since then and where South Africa fits there.
Yes, it does seem quite a lot, and you're absolutely right that it was 4 years ago that all world leaders committed themselves to achieving universal health coverage. And you mentioned at the start there that some countries have introduced it around South Africa's income level. I would actually say it's most countries that in many respects, South Africa is a bit of an outlier for not having done it earlier. So certainly one feels that sort of given the economics of the situation and the wealth in the country, that the country definitely could afford to make the move that the likes of Thailand did over 25 years ago. Yeah.
Where are we getting things wrong then?
Well, I think it does take time to do these things, and also it is undoubtedly highly political. You know, that moving to a predominantly publicly financed health system, which basically means that healthy, wealthy people, as well as getting their own health care, they help subsidise services for the sick and the poor, is a tricky process, and I think it is unfortunate that the health system that South Africa inherited in 1994 was more akin to, I think, a US-style health system, two-tier health system that was very inequitable. And it often proves quite difficult to change from that as being the main blocker.
Yeah. You know, typically, whenever we speak about NHI, the affordability discussion is what takes center stage. And the sense I'm getting from you is that it is a factor, but often it's used by critics to dismiss this kind of system, whereas in fact, at least in South Africa's context, it doesn't really hold water, this idea that we can't really afford it.
Oh, absolutely, and you can definitely afford it. There's no doubt whatsoever. With your total health spend at the moment being about 8.5% of GDP, that is really quite high. Your problem is that half of that is tied up in really quite inefficient and inequitable private health insurance schemes, and half of it is in public financing. But if you sort of take that roughly, that sort of quantum of financing,